Heart disease is the leading cause of death for both men and women, claiming a life every 34 seconds. But did you know that heart attacks don't always come with classic symptoms like chest pain or shortness of breath? In fact, many seniors experience no symptoms at all before having a heart attack. This is why it's important to be aware of the hidden signs of heart disease, so you can seek medical attention right away if you notice any of them in yourself or someone you love. In this video, we will share 10 hidden indicators of heart disease in seniors that demand your immediate attention. If you notice any of these signs, don't hesitate to contact your local emergency services or get medical help right away. Let's get started. Number 1. Changes in urination. When it comes to detecting heart disease, you might not think of urination as a key indicator, but it could be an important clue. A sudden increase in the frequency of urination, especially at night, could signify that your heart isn't functioning properly. Our kidneys play a vital role in regulating fluid balance in our bodies. When they receive signals from hormones produced by the heart, they adjust how much fluid is reabsorbed back into the body. However, if there are issues with the heart, these signals can become distorted, leading to the kidneys releasing more fluid than usual. While this might seem like a small change, it could actually indicate something serious going on with your heart. By paying attention to your urination habits and seeking medical advice when you notice any changes, you can potentially catch signs of heart disease early and take steps to protect your health. Number 2. Swollen legs, ankles, or abdomen. Swelling in the legs, ankles, or abdomen can be a sign of heart failure. When the heart isn't pumping efficiently, blood can back up in the veins, causing fluid to leak into the tissues. Seniors with heart failure often have fluid retention as their bodies try to compensate for the reduced blood flow. If you notice that your loved one has persistent swelling in their lower extremities or abdomen, it may be time to schedule a doctor's appointment. Early detection and treatment of heart failure can significantly improve outcomes and quality of life for seniors. So don't ignore these signs. Number 3. Persistent cough or wheezing. A persistent cough or wheezing can be a sign of congestive heart failure. When the heart isn't pumping efficiently, blood can back up in the lungs, causing fluid to accumulate in the air sacs. This fluid can irritate the lining of the lungs, leading to coughing and wheezing. Seniors with heart failure often develop a chronic cough that may be worse during the day and can worsen over time. If your loved one has a chronic cough or wheezing that doesn't go away, it may be time to schedule a doctor's appointment. Early detection and treatment of heart failure can significantly improve outcomes and quality of life for seniors, so don't ignore these signs. Number 4. Fatigue or weakness. Persistent fatigue or weakness can be a sign of heart disease. When the heart isn't pumping efficiently, the body may not get enough oxygen-rich blood, leading to feelings of tiredness or weakness. Additionally, heart disease can cause the body to work harder to pump blood, which can also contribute to fatigue. Seniors with heart disease may also experience shortness of breath, which can make everyday activities feel more tiring. It's important to note that fatigue can be a symptom of many different conditions, so it's not always a cause for alarm. However, if your loved one is experiencing persistent or unexplained fatigue, it may be worth checking in with their doctor to rule out any underlying heart concerns. Number 5. Chest pain or discomfort. Chest pain or discomfort, also known as angina, is a classic symptom of heart disease. When the heart doesn't get enough oxygen-rich blood, it can cause chest pain. This pain can feel like a pressure, tightness, or squeezing sensation in the chest. The pain may radiate to the left shoulder or arm and be accompanied by shortness of breath, nausea, or sweating.
If you or your loved one experience chest pain, it's crucial to seek medical attention immediately. Don't try to drive yourself to the hospital. Instead, call an ambulance or ask a friend or neighbor to drive you. Time is critical when dealing with chest pain, as prompt treatment can significantly reduce the risk of heart damage. Number 6. Fast or irregular heartbeat. A fast or irregular heartbeat can be a sign of several heart conditions.
When the heart beats too quickly or erratically, it may struggle to pump blood effectively, leading to symptoms like shortness of breath, lightheadedness, or fatigue. Seniors with heart disease may also experience arrhythmias, which are abnormal heartbeats that can disrupt the heart's rhythm. Arrhythmias can make the heartbeat too fast, too slow, or with an irregular pattern. Some arrhythmias may not cause any symptoms, while others can lead to palpitations, dizziness, or chest pain. If you notice that your loved one's heart rate is consistently high, or if they're experiencing palpitations or dizziness, it's essential to consult a doctor. Early detection and treatment of heart disease and arrhythmias can prevent further complications and improve overall health outcomes. Number 7. Cold hands or feet. Cold hands or feet could indicate poor circulation, which is common in seniors with heart disease. When the heart struggles to pump blood effectively, it can cause blood flow to become sluggish. This means that essential nutrients and oxygen may not reach the extremities as quickly as they should, causing them to feel cold. Additionally, seniors with heart disease may have narrowed arteries, which can restrict blood flow and make it harder for blood to reach the hands and feet. If you notice that your loved one's hands or feet are consistently cold, it could be a sign of poor circulation and a potential indicator of underlying heart issues. Number 8. High blood pressure. High blood pressure, also known as hypertension, is a major risk factor for heart disease. When the force of blood against artery walls is consistently too high, it can cause damage over time. This can lead to the arteries becoming hardened and narrowed, making it harder for blood to flow through. Over time, this strain on the arteries can also lead to the development of heart disease. Many seniors with hypertension don't experience symptoms, which is why it's often called the silent killer. However, high blood pressure can eventually lead to other health problems such as heart disease, stroke, or kidney disease. Therefore, it's essential to monitor blood pressure regularly and consult a doctor if it's consistently high. Number 9. High cholesterol levels. High cholesterol levels are a major risk factor for heart disease. When there's too much cholesterol in the bloodstream, it can cause plaque to build up inside the arteries. This buildup, also known as atherosclerosis, narrows the arteries and restricts blood flow to vital organs such as the heart. As the plaque grows, it can also rupture, leading to blood clots that can block the flow of blood entirely. This can cause a heart attack or stroke. Many seniors with high cholesterol don't experience symptoms, which is why regular checkups and monitoring are crucial. If high cholesterol levels are detected, lifestyle changes and medications can help manage the condition and reduce the risk of heart disease. Number 10. Family history of heart disease. Having a family history of heart disease can significantly increase a senior's risk of developing the condition. When there's a history of heart disease in a family, it could be due to genetic factors that make individuals more susceptible to developing the disease. This means that if a parent or close relative has had heart disease, their children and other relatives may also be at a higher risk. It's essential to be aware of one's family history and discuss it with a healthcare provider, especially if there's a strong history of heart disease. By understanding their risk factors, seniors can take proactive steps to prevent heart disease and maintain good cardiovascular health. Recognizing the warning signs of heart disease in seniors is crucial for ensuring their well-being and longevity. By being vigilant and seeking medical help when necessary, you can help keep your loved ones safe from this potentially life-threatening condition. Remember, knowledge is power when it comes to your health. Thank you for watching today's video. If you found it informative, please hit the like button and subscribe for more health tips. Stay healthy and take care.